Hello and welcome to this NDTV special event where I am joined by my colleagues Vishnu Shom and Nidhi Kulpati to focus attention on a very important aspect of the fight against the coronavirus, which is our frontline health workers. We're focusing on Médecins Sans Frontières, or MSF, or Doctors Without Borders, as many of us know them. They've been fighting the coronavirus pandemic around the world, and even here in India, in Mumbai and Bihar, where they have projects ongoing. And crucially, they need your support to provide important safety equipment and a whole host of other aspects that will allow them to do their work serving vulnerable communities at this time. Vishnu, Nidhi.
Well, COVID-19 remains a health emergency, a deadly threat, especially to the most vulnerable. Médecins Sans Frontières has been responding to the global pandemic since it began. MSF doctors and nurses are treating patients and supporting communities across Europe, Africa, the Americas and Asia. Now the independent medical organization is starting operations to combat COVID-19 in India by setting up dedicated medical facilities to treat COVID-19 patients in Govandi, Mumbai and Patna and Bihar, where the needs are huge and growing, and improving hygiene and sanitation among at-risk communities. Médecins Sans Frontières is working hard to save lives and contribute in the fight against COVID-19.
और आपको बता दें कि किस तरह से जब कोरोना वायरस फैलाव जो है इसका सरहदों को पार करता गया, तो ऐसे में उससे मुकाबला करने वाले हमारे डॉक्टर्स और स्वास्थ्यकर्मी भी सरहदों के परे इसे हराने में जुटे हुए हैं। दुनिया भर के डॉक्टर्स और स्वास्थ्यकर्मी मिलजुल कर ये कभी वैक्सीन तो कहीं दवाइयाँ जुटाने में लगे हैं। और इन्हीं में से एक संस्था है जो 4 महाद्वीपों, 70 देशों और हमारे देश में 9 राज्यों में कोविड-19 को हराने में जुटी हुई है। MSF यानी मेडिसिन सॉन्स फ्रंटियर्स यानी डॉक्टर्स विदाउट बॉर्डर्स एक स्वायत्त संस्था है जो आज गुजारिश कर रहे हैं आप सबसे कि इन योद्धाओं के लिए सुरक्षा के उपकरण, PPE किट्स, हाइजीन किट्स, टेक्निकल मेडिकल इक्विपमेंट, ऑक्सीजन कॉन्सेंट्रेटर्स, इन सब के नाम आपने सुने होंगे। इनके लिए राशि जुटाने के लिए आप लोग भी जुड़े। तो आपको बता दें कि MSF को नोबेल प्राइज भी मिल चुका है।
Well, the work of MSF around the world has been absolutely incredible. Médecins Sans Frontières deployed all over the world in areas where people need help and desperately. As we start this telethon, this program, let's give you an idea of the work of this incredible group.
They come from all over the world, united in one purpose: to help people and fight a global pandemic.
Médecins Sans Frontières, or Doctors Without Borders, is an international medical humanitarian organization which provides medical assistance to people in crisis around the globe. MSF has over 40 years of experience in responding to outbreaks of diseases and epidemics.
Médecins Sans Frontières, more commonly known as Doctors Without Borders, is a medical humanitarian organization founded in 1971. This group of dedicated professionals has been working, treating patients and supporting communities across Europe, Africa, the Americas and Asia ever since the pandemic began. Now they have set up 2 dedicated medical facilities to treat COVID-19 patients in India.
In India, MSF is working with Bihar and Maharashtra state governments to provide medical care to COVID-19 patients and to protect people who are vulnerable and at risk.
And it is not just medical care. MSF, or Doctors Without Borders, are also working to improve hygiene and sanitation among at-risk communities. Now, they need our help to get personal protective gear and crucial medical equipment. Join MSF and NDTV to support these caregivers. Donate so they have what they need to keep us safe. Unite without borders.
All right, joining us on the show, we have with us Shobhana Kamineni, who is the Executive Vice Chairperson of Apollo Hospitals Enterprise, former CII President. Great to have you. As always, Shobhana Kamineni. The focus is on frontline health workers. And tell us about how you have, at Apollo, tried to ensure that your own frontline health workers are protecting themselves even while they're protecting others. How much of a challenge has that been?
Srinivasan, at this moment, it's really hard. It's been a hard week. Everywhere we've had to step up our facilities. And as for the doctors and the nurses, everyone in the front line, they're really not thinking about their lives. It's only, at the back end, us supporting them. We've done whatever we can. And the thing is never to let your guard down. So a lot of these people, they're working flat out, but we work them for 1 week, quarantine them for another. And it's just incredible the amount of bravery, sacrifice, and more than anything else, the professionalism that they put into fighting for people's lives. And we've seen it because in every hospital of ours, every day there are queues waiting for us to admit people, and we're continuously expanding beds. This situation is quite difficult, and I think in the coming weeks it's going to be more difficult.
Ms. Kamineni, how difficult is it going forward? Because this infection of the virus loaded India is nowhere close to coming to an end. We are far from flattening the curve, and your health workers are constantly exposed. It's been several months already, and they're going to be exposed for an indefinite period of time going forward. Is that a bigger concern for you, that here are people, as you mentioned, who've been working 24 hours a day, and yet their work is not even half done?
I don't know how to put this, but 80% will get this. The people who are infected will be asymptomatic. So a lot of our people fighting understand the risk. And, what can I say? To tell you the truth here in this situation, you have to be prepared. The people that are out there, even in the US, all the healthcare workers, to tell you frankly, they know that there's a big chance that they're going to contract it. And especially by the time this war is over, before there's a vaccine, I think that a lot of them are going to have that, they're going to face their own personal challenges. The only thing that we can say as Apollo is that we will ensure that we will treat every single one of our people who are on the front line, and we are geared up with all the necessary medicine, PPEs, ventilators, whatever that is required is available with us to make sure that those that are treating the frontline people, we'll protect them.
Let me just go across to Dr. Prince Matthew, Regional Director, Asia for Médecins Sans Frontières. Dr. Matthew, let me ask you a slightly different question about your choice of where you've chosen to work in India. You're working in Mumbai and Govandi, but also Bihar. Any reason for choosing these locations in particular?
So, well, MSF has had a long history of humanitarian medical work in India since 1999 and Bihar since 2007. We've responded to many emergencies there. In Bihar, we have a project on Kala-Azar, on malnutrition, on advanced HIV, etc. So when the COVID crisis happened, one of the things, apart from responding to apart from responding to reorienting our existing projects, was to really add to adapt to COVID. We also looked at supporting the places that we were in. So Bihar was a particular focus area for us, especially with the return of lakhs of people back to Bihar state from large cities like Delhi and Maharashtra, and the potential to overwhelm the existing healthcare system there. We've had a long-standing collaboration with the Bihar Health Department, and that continues here as well. In Mumbai, like you mentioned, we work in M East block near the Govandi slum area, which is also a very vulnerable area with a very vulnerable population. So those choices kind of dictated our projects in both these places.
Dr. Matthew, you turned an indoor stadium in Bihar in Patna into a 100-bed facility. What are the challenges you are facing there? चुनौतियाँ क्या हैं वहाँ पर आपके सामने?
So, one of the challenges, the biggest challenge for us was to start a new project in the middle of a lockdown of 1.3 billion people. And this was particularly difficult because all of the usual things that we could normally get, medical supplies, surgical equipment, transport, the availability of medical staff coming from different places of India, all of this was particularly a challenge for us to get. Remember, trains, flights, all of these were locked down. And like I said, we were also going into a state where the health system could easily be overwhelmed by the number of people coming in. So what we wanted to do was to create an additional temporary structure where without putting this load onto the existing healthcare system, we could manage to do something. And that is how we set upon this idea of converting the Patliputra Sports Complex into a full-fledged COVID hospital with all of the necessary, infection prevention control measures, changes of the ventilation system, changing of the flooring, setting up different wards, and so on. And so that's what we've done essentially now in Patna.
Dr. Matthew, what more does Médecins Sans Frontières do in India to combat COVID-19?
So, the added value that we're bringing to the Bihar state response is the provision of oxygenated beds for moderate cases of COVID. So what we've seen across India is that there is what we call an oxygen gap, where the availability of oxygenated beds is quite less. And this is critical as we respond to the COVID crisis. Having enough number of oxygenated beds with high flow oxygen at 10 liters per minute available 24/7 for those subset of patients that have moderate COVID and required oxygen. So that is something that we're bringing to the forefront in Patna with about 100 oxygenated beds available to the state response. We're also looking at some of the other things. For example, mental health support is particularly key. Don't forget that apart from the physical effects of COVID, COVID also has tremendous stigma and discrimination, particularly for healthcare workers. Many of them who are away from their families, working long hours, no support mechanisms exist, etc. So something that we want to do is provide mental health support to healthcare workers and other frontline workers like Ashas, Anganwadi workers, etc. going forward. We also have a new helpline that's starting now, and that is available to healthcare workers and their families, etc.
Okay. All right. Wonderful. Thank you so much indeed, Dr. Matthew. We spoke earlier also to Dr. David Nabarro, who is the WHO Director General Special Envoy for COVID-19 response in India. And I began by asking Dr. Nabarro about the importance of groups like MSF and WHO's experience of working with them.
When we're dealing with a major global issue like what we're experiencing now with COVID, we all need to work together because it's a problem affecting the whole of humanity. And it really does require partnership between all who have the capacity to help. Within public health, we have many organizations that put the needs of people, particularly poor people, really up front and at the center of attention. They want to leave no one behind. One of these organizations is Médecins Sans Frontières, or Doctors Without Borders. I've actually been working alongside and often with this organization for many decades, and I'm totally impressed by their absolute dedication to serving the needs of the person who is ill, the person who needs help, regardless of who she or he is, regardless of wealth, regardless of nationality, just always saying that an individual's life and well-being is the most valuable thing in the world, and this is the commitment of Médecins Sans Frontières. Now, there are many other organizations that do the same. And so I hope that in the telethon, you will pay respect to and get support for all the organizations that are totally committed to helping people recover from disease. And I'm so glad that there's a particular focus on COVID, because this is causing such huge problems around the world, particularly for poor people, for people who live in very crowded settlements, for people who are unable to navigate to get safer working conditions in their places of employment. They need support, and that's why Médecins Sans Frontières is so important at this time.
Dr. Nabarro, what are we learning about the virus that's important for frontline workers like Médecins Sans Frontières?
So perhaps the most important learning is that this is a really dangerous virus. It's very easy to underestimate it because the fatality rate is relatively low, but it has a lot of other impacts on people's well-being. And the fact that it does unfortunately kill a significant number of people does mean that we have to take it seriously. Second learning is that as soon as an outbreak appears in a locality, it's necessary to try to stop transmission with immediate effect. This does not mean having a whole lockdown on the country, but it does mean identifying where the virus is and acting quickly to interrupt transmission and ensure that people are not exposed. Thirdly, and perhaps my last point for now, is that it's really important that hospitals and health centres are properly supported, because health workers experience a high exposure to the virus. So enabling health workers to protect themselves whilst ensuring that hospitals can provide the best possible service and prevent people from dying is absolutely critical. So being able to act rapidly, being able to ensure that health services work, and taking the viruses seriously, they are key learnings that I've certainly picked up over the last few months.
Dr. Nabarro, would you praise India's efforts given how the virus is surging?
So firstly, I want to stress that the best way in which we control this virus is by interrupting transmission wherever it occurs. But it's really hard to do that in densely populated areas. It's really hard to do that when you've got millions of people who are perhaps migrating away from their homes and coming to work in cities and then suddenly finding the work is not available anymore. So it's a tough thing to do to contain this virus. And I'm really impressed with the speed with which India reacted. But I'm also aware that the problems are there still now. What I want to stress to everybody is that if India had not been strong at the beginning, the virus would be much more widespread in your country. You'd have a doubling time of infections of 3 days. As it is, you've been able to slow the doubling time, and that's been remarkable. Secondly, you've got much greater public awareness of what's needed now as a result of the lockdown than would have happened if you hadn't done so. So all I want to say to everybody is this is a tough virus to control. It's very difficult to contain outbreaks. But if you had not acted in the way that you have, your situation would be much, much worse. And I ask you please to continue with the same strategy, because that's the only way that we know for controlling this disease, interrupting transmission, isolating those with the disease, and protecting those who are at high risk.
We're joined now by Dr. Christos Christou, who's the international president of MSF. Tell me, Dr. Christou, now MSF has fought literally at the front lines of actual wars. You've gone into conflict zones and you've helped there. How much of a challenge is fighting a global pandemic? How is it different from the kind of battles that you have fought in the past?
First of all, thanks for the invitation and for giving us this opportunity to present a little bit of what we are doing, and especially what we are doing the last months since the pandemic started. As a big medical humanitarian organization, our first priority was, of course, to maintain the already existing activities, to make sure that all programs are running smoothly and all essential services are still provided to those that they are more in need. And that was not not an easy task at all, as we understand. On top of this, of course, we have launched new activities in direct response to the pandemic. In some countries, we have had to repurpose our projects and stuff, including some temporary closures of projects, so that we can focus resources on emergency preparedness and scale up where we can. We have an accumulated experience in outbreaks, with the most recent one in the Ebola outbreak, and not just this, that we would like to share with everyone. And you may have noticed that a couple of our interventions were in very deep well-developed countries with very much sophisticated systems. However, it was important even there to provide some experience that we have. And on top of this, of course, also to make sure that the most in need, the most vulnerable people will always enjoy the essential services. So you see projects in Europe, you see projects in the United States, in Canada, and of course in all other places where we traditionally operate.
Dr. Christo, what has, for the benefit of our viewers, Médecins Sans Frontières been doing internationally? What challenges have you faced as an organization in meeting patients' needs and adapting to new circumstances?
The key challenges that we faced since the beginning and we're still facing are how to better mobilize our staff and our supplies. And indeed, we still also need the essential equipment. We need the PPEs, the famous PPEs, because without the PPEs, we cannot provide the safety that all our healthcare workers need in order then to treat the patients. So PPEs, the mobilization of our staff, the supplies that they cannot move from one place to the other due to several different restrictions in the traveling between the countries are the priorities. And of course, with this, another priority for us is to make sure that all the other patients, all the other needs, all the other diseases that they were always existing will not be just evaporated because of COVID. All these needs will still be addressed to these people. And this is a huge challenge as well.
Doctor, you yourself are an emergency trauma surgeon. What role can MSF or other medical humanitarian actors play in global health emergencies today, and how can people support them?
That's a very good question, because it is an emergency. It is one of the emergencies that no one really knew what to do. We're still learning. So one of the things that we have to do is to pay much attention to the evidence, to the scientists, and understand exactly what science wants to tell to us. How this is interpreted into action, this is where also humanitarians and medical humanitarian organizations like the Médecins Sans Frontières, the Doctors Without Borders, that they have huge experience, can help also the others, reminding that this is just a crisis within other multiple crises, and we have to really look at the populations, understand their needs, and adjust every solution that we want to give based on the need and the particularities of each context and each population. And we are very willing to do that, because we want to remind to everyone that the needs are many more than anything related to COVID. Babies will still be born, vaccines will still be required, the need for life-saving treatment will not disappear. We have victims of wars, we have malnourished kids that still need our help. We have reproductive health services that need now even more than ever. And in all these things, I think MSF can, of course, not fulfill all the needs, but can be there and remind that it doesn't matter that much only how much people have been infected by COVID, but also how much they will be affected by this in all different neglected corners around the world.
Right. Okay, Dr. Christo, thank you very much indeed for joining us. And just to remind our viewers that you can contribute to the frontline workers of MSF. The details of how you can do that are on the screen constantly. Let's go across to Dr. Ashish Jha, Katie Lee Professor of Global Health at the Harvard T.H. Chan School of Public Health, Faculty Director of the Harvard Global Health Institute. Dr. Jha, great to have you with us. Dr. Jha, give us a sense of how the virus is playing out in terms of this constant challenge that countries around the world are grappling with at this late stage of the rising curve of the virus, where you're locking down and you're opening up and then you're seeing the virus surge. Just look at what's happening in America, where you are right now, where states are closing down now after perhaps opening up too early. What are the lessons you're seeing there of what's happening in America and how that would also play out for us here in India?
Yeah, so thank you for having me on. We are still very early in the pandemic. The most important thing for people to remember is that we are many, many months away, probably a year or so away from having a safe and effective vaccine that's widely available. Until then, we are going to be battling this virus. And what we're seeing in the United States, which is turning out to be one of the worst responses of any advanced country in the world, is that we opened up very early. We didn't have a good plan for how to stay open. And many parts of the country we're seeing surges in cases. And I am worried that many parts of America are going to have to close back down again. And I think this is an important lesson for India, because I have been very supportive of India's initial lockdowns. I thought they were the right policy. But as India has opened up in the last month or so, we have started seeing surge in cases now, more than 20,000 cases per day. I expect that will continue to rise in the upcoming days and weeks and months. And the question is, what is India's strategy for curtailing the virus before it gets out of hand and we have to shut down large parts of India again?
Dr. Jha, I would like to understand, what are the challenges in front of doctors? Are they different in US and different in India, or the ground situation is the same?
You know, the ground situation in many ways is the same. If you're a doctor in Boston, or you're a doctor in Mumbai, or Bangalore, or anywhere else, or in Bihar, where I'm from, you're going to, in some ways, face the same set of challenges. Of course, the context is different and the resources are different. But what you have in front of you is you're going to have people who are very sick, who will be very high risk for spreading the disease to others, to other patients, but also to doctors and nurses. And we are only now identifying treatments that really can make a difference. So it's very, very critical that we support our frontline healthcare workers, nurses and doctors and others, both in how they provide care, but also really making sure that we keep them safe.
All right, sir. Thank you so much for sharing those views with us. Indeed, the situation in America is a big concern indeed. Well, joining us now are staff of so many across the country and in fact in so many parts of Asia. Baichung Bhutia, former captain of the Indian football team. Thank you very much, Baichung, for joining us. What role do you believe that organizations like Médecins Sans Frontières have, along with so many others, in reaching out to those who are worst affected in the worst affected areas of India?
So I think the most important thing for us right now is to make sure our health workers who are working for people who are suffering from COVID are safe. I think that's the most important thing. And, been watching and following COVID-19 from the day one. I think a lot of the complaints across actually in India, what we've been hearing, especially from our doctors, nurses and health workers, are they're not being able to get the right equipment. And I hope that issue is much solved. So I think if the doctors, nurses are equipped properly and the PPE kit to, other equipments are given and they are safe, I think that's where they have more confidence to go and work and help the people who are really suffering. So I think first thing we would really want to make sure is keeping our health workers safe to work for the patients.
बाचुंग जी, आपको देखते हैं तो फुटबॉल की याद आ जाती है और कोविड में सबसे ज़्यादा हमारे स्पोर्ट्स को असर डाला है। बच्चे युवा नहीं जा सकते खेलने के लिए। आप क्या कहेंगे छात्रों से, स्पोर्ट्समैन से आज?
मैं यही बोलना चाहता हूँ कि आई थिंक दे शुड स्टे पॉजिटिव, डेफिनेटली स्पोर्ट्स पर्सन्स के लिए, एंड स्पेशली फॉर I was talking to Leander Pace few weeks ago. I was also listening to Mcrae. I think they were preparing for Olympics, which was this year, and especially for athletes who are with the age is coming towards the end of their career, it makes a big difference because they're looking forward to it. And 1 year of postponement of any big event like Olympics, which you've been waiting for 4 years, it makes a big difference for their performance. So I feel a little worried about them, but they have been, I was speaking to Leander and he was very positive that he will stay fit and give his best, even if it delays for a year. So I would only see that, athletes around the world and especially in India stay positive. I know, they can't, I'm sure, but last 1 month, the government is allowed athletes to go and start training. So I think they must be starting to work out. It's very important for them to keep fit. But I want to mention one important thing is I think what I don't really see with the government of India is promoting health to people in different countries. In fact, also building the small immunities by, I was hearing to Prime Minister today, like some of the few things which you can eat, drink to build your immunity. So I think at the same time, I think it's important that we also build awareness to keep our people, just not sports person, but entire people in India fit and healthy during this pandemic as well. If they could do their yoga, do morning walks and jog, and also take some proper, which our Indian, we have got a lot of spices which can really build immunity. I think these are small things we start taking precautions rather than, once it gets affected, then taking, medicines.
Okay, well, that's great advice. Baichung Bhutia's fitness mantras. Thanks very much indeed, Baichung, for joining us. Also joined now by Dr. Abdul Samad Ansari, Director Critical Care Services at the Nanavati Hospital in Mumbai. Great to have you, Doc Ansari, with us now. We were there, NDTV crew, filming at Nanavati some weeks ago. At that time, your ICU was your COVID ICU was full to the brink, lot of pressure. How are things now, Doc? Is it still a lot of pressure? Is it a little better?
So, Vasu, the pressure is still very high on the intensive care sector. And maybe because of the opening up, the government has been very proactive, has been chasing the virus. And we have been managing mildly symptomatic and moderately symptomatic individuals in better setups like designated COVID healthcare areas and, COVID care centers, which have definitely taken the pressure off the specialty hospitals. But nonetheless, the number of critically ill patients is still, I would say, on the rise or at least on a high plateau. Over the last 100 days now, I would say, that we have been having dedicated COVID ICUs, our number of patients or the fraction of the patients who are on invasive ventilator have definitely gone up, despite we realizing that non-invasive ventilator is a better modality of care. So I would like to say that we are seeing actually a paradigm shift in the age group also, which is getting involved with severe disease. Initially, we were not seeing too many patients with the age group of 35 or 45 and less than 65 really coming with bad illnesses, which we are now witnessing. The other organ dysfunctions are also catching up. And I think it's no more a disease which is catching only people with comorbidities.
डॉक्टर अंसारी, मैं आपसे समझना चाहूँगी मुंबई से खास तौर से कि क्या हमारे लोगों को समझ आ रहा है कि धीरे अनलॉक हो रहा है, वो भी ज़रूरत है अर्थव्यवस्था के लिए, लेकिन कैसे अपना बचाव कर सके? जिस तरह से कह रहे हैं, आपने बताया कि तमाम एज ग्रुप्स अब बढ़ रहा है ये, तो क्या आपका आंकलन है, असेसमेंट आपका क्या है?
I think we need to have much more responsibility in the public sphere, which is definitely better than what it was before. So I do want to say that you look around and you see people wearing masks all the time who didn't do that. They are trying to always carry some kind of a sanitizer. They are following the social distancing much more easily. So I think I'm sure this disease has changed the concept of public health for all of us, especially in India. But nonetheless, the change is probably not sufficient enough, or the quantum looking at the burden of the disease is still very poor. अभी भी मेरा ऐसा मानना है कि हमारे पास जो education है to understand what are our basic defense mechanism of proper cough etiquettes, hand hygienes, distancing, not moving out unnecessarily if not required, working from home, is still not percolated down, probably to all the strata. I would say we still need to work and probably partner with some NGOs in this. And probably this is one of the best attempt to make it happen with all the people, realizing that it's a fight that we all are involved in, not just the doctors or the police people or the, Safai Karamcharis.
Yeah. Right, sir. Well, thank you so much for sharing those thoughts with us. The battle is far from done. We need to keep fighting. Absolutely, sir. Well, joining us, Sandeep Agarwal. He's the incoming governor of the Rotary Club of Bombay. Thank you very much for being with us, Mr. Agarwal. How are you supporting this cause? Why is it so important for you to do so?
So when this outbreak happened in March, we took a decision both at the club as the district level that we have to step forward, whatever the consequences. And we support this in many ways, meals distribution, but also primarily medical equipments. We have given a lot of ventilators in the past. We've given high-flow oxygen cannulas, and our attempt will continue to supply these high-flow oxygen cannulas and some ventilators, and now even dialysis machines to the needy hospitals in and around Mumbai and across Maharashtra.
All right, sir. Thank you so much for joining us and explaining how you are contributing in this entire process. Joining us now, Dr. Stopdan Kalon, Medical Coordinator of Médecins Sans Frontières COVID-19 project in Mumbai. Dr. Kalon, how are frontline healthcare workers and other caregivers from sanitation and hygiene experts coping in this current situation?
Yes, indeed. It has been a massive challenge for the healthcare workers on the front line. First of all, it had been a new disease. There was a lot of misinformation, around. There was fear among the healthcare workers of contracting this condition and passing on to their families and things like this. So what we did was, first of all, as my colleague said, ensuring that the healthcare workers be saving this period actually. So what we did was make sure that we could provide them the best infection control and personal protective equipment and conditions to work in, which involved a lot of things to be done with the patient care, as well as improving the organization of patient care and also coming up with innovative things like telemedicine and mobile health, whereby patients could be provided care being at their homes instead of having to come to their health facilities. And also for the staff, what we did was also providing them shuttle transportation from their homes so that they could come to the healthcare facilities in a safe way. And yes, the staff are continuously provided with updates about how to maintain these safe environments and improving the safety standards continuously.
Right. Dr. Kalon, how has the pandemic affected MSF's current patients? For example, those that you're working on with TB treatment.
Oh yes, as the national program itself has reported, it has been quite severely impacted. First of all, the case finding itself, we saw a massive drop in case finding of new patients, and then the continuity of care was a challenge. Just to give you an example, in the slum settings where we work in Mumbai, it is perhaps the most heavily burdened TB context in Mumbai. Out of the nearly 4,000 patients, we got to know that about nearly 600 had left for their homes in Bihar and UP and other places. So that was, and another challenge was the routine monitoring and care of the patients. Patients not being able to come for various reasons was a massive challenge. Yeah.
Right. Thanks so much for sharing those thoughts and that experience with us. We're now joined by Vikramjit Singh Soni. He's the chairman, he's the chairman of Sun Foundation, the president of the ICC Paris, India. Thanks, Mr. Sani, very much for being with us. Tell us a little bit about the Corona Mobile Testing Clinic bus that you've donated to the Delhi government. It was flagged off earlier on. I think it's a fantastic idea. Tell us a little bit more about the role that this bus is playing.
This is the first artificial intelligence enabled mobile corona testing bus, which has got facilities for thermal scanning, rapid test PCR, throat and nose swab test, and it has got an inbuilt ambulance in it. And we had done it in collaboration with the Delhi NCT government of South Delhi district, flagged off on 1st June. It is testing about 550 to 600 patients at their doorsteps in various containment zones and various other slum areas. And it has also got an award for SCOC award for South Delhi district out of 500 districts. So I think it was a good step because, you know, Delhi is a center where we are having a highest TPR ratio of about 29.7%, and there's a large surge, and now they are going to the testing has to increase and there will be surge of cases. And this experiment has paved, we have got a very positive feedback for testing at the patients or asymptomatic patient at the doorstep. So today we are announcing on this occasion of your program of donating a second bus for state of Punjab. And I must say the state of Punjab is one of the positive states which has very less number of active cases. So, but still the testing has to be done in the rural areas. So CM Punjab and they have requested our Sun Foundation, so we are partnering with them, and the bus is under fabrication.
That's superb, sir. And I'm sure that bus would do a fantastic work there like it's done in Delhi. Thank you very much. Sanidhi?
मिसेस सवाने, मैं आपसे ये जानना चाहूँगी कि आपने अब बहुत धन्यवाद आपका कि आपने पंजाब के लिए भी इस तरह से मोबाइल टेस्टिंग वैन की घोषणा की है। बहुत बहुत शुक्रिया तहे दिल से। क्या विचार अब, क्योंकि इसकी तो मांग और राज्यों में भी होगी, क्या सोचा है आपने इसके बारे में?
नहीं, हमने सेंट्रल हेल्थ मिनिस्टर को भी लिखा है और स्टेट्स को भी लिखा है कि वो भी उनको रेप्लिकेट करना चाहिए मॉडल, क्योंकि हम एनजीओ हैं, जिन स्टेट्स में हम कर पाएंगे हम ज़रूर करेंगे, लेकिन उनको भी ये रेप्लिकेट करना चाहिए मॉडल, क्योंकि बहुत बसेस अवेलेबल हैं और इससे जो डोर स्टेप में टेस्टिंग का है वो इससे बहुत, क्योंकि आज जो मेन समस्या आ रही है दैट इज़ कमिंग दैट वी आर नॉट एबल टू टेस्ट people, and now there is a talk of 2 lakh tests per day. So I think this is at their doorstep, and especially for people who are shying of going to hospital or who cannot afford to go to hospital or whatever reasons. So I think every state should adopt this sort of mobile clinic.
बिल्कुल। मिसेस सानी, जो आज की हमारी मुहिम है, ये कैंपेन है, वो है डॉक्टर्स बियॉन्ड बॉर्डर्स। जो डॉक्टर्स हैं सरहदों के पार जाके मदद कर रहे हैं, तो इसमें इन डॉक्टर्स की, मेडिकल केयर वर्कर्स की, केयर गिवर्स की मदद हो सके, उनको पीपीई किट्स मिलें, चाहे तो मेडिसिन्स या हाइजीन किट्स हों, इसके लिए आज हम काम कर रहे हैं। उस बारे में क्या आपके विचार हैं?
मैं ये समझता हूँ कि मेडिसिन साइंस फ्रंटियर्स बहुत अच्छा काम कर रही है, यूनिटी बियॉन्ड बॉर्डर्स, और ऑन दिस ओकेजन फ्रॉम आवर सन फाउंडेशन आई कमिट 500 PPE kits, surgical gloves, mask, complete 500 kits to MSF through NDTV, and I congratulate all of you for this initiative creating awareness. और साथ ही में मेडिसिन साइंस फ्रंटियर्स को जहां 500 किट्स की कमिटमेंट कर रहे हैं, वहां ये भी उनसे दरख्वास्त करूंगा कि दिल्ली में जहां जैसे मैंने पहले कहा टेस्ट पॉजिटिविटी रेट बहुत ज़्यादा है, उन्होंने बॉम्बे में और बिहार में, पटना में जैसे सेंटर्स बनाए हैं, तो दिल्ली सिख गुरुद्वारा मैनेजमेंट कमेटी के साथ मिलके हम लोग वर्ल्ड पंजाबी ऑर्गेनाइजेशन और सन फाउंडेशन, वी हैव गॉट फैसिलिटी ऑफ 850 बेड्स, वो भी आपके माध्यम से, एनडीटीवी के माध्यम से आज हम उन्हें ऑफर करते हैं कि हमारे पास बेड्स हैं एंड बोर्डिंग, लॉजिंग और लंगर, वेरी हाइजीनिक फूड। अगर वो यहाँ पे दिल्ली में भी एक सेंटर ऐसा DSGMC और हम WPO और सन फाउंडेशन के साथ मिलके खोल सकें तो ये भी एक बहुत अच्छा इट विल बी क्योंकि द मोर द मैरियर बहुत काम हो रहा है सरकार सेंट्रल गवर्नमेंट पर ये 850 बेड्स वी आर ऑफरिंग थ्रू योर चैनल एंड वी विल अरेंज ऑल बोर्डिंग लॉजिंग बेड्स फूड या और आखिर में मैं यही कहूंगा कि हमें इस एपिडेमिक से लड़ना है तो श्रीनिवास जी कुछ भी ठान लीजिए तो फिर आन होती है पंखों से कुछ नहीं होता हौसलों से उड़ान होती है लेट अस डिफीट दिस कोरोना विद केयर एंड कंपैशन थैंक यू
राइट Okay, wonderful. What a great message. Thank you so much, Mr. Sani. Joining us now, Dr. Anjan Trikha, Chairman of Clinical Managerial Group, COVID Center, All India Medical Sciences. Dr. Trikha, let me just ask you at the outset that because the focus so much is on frontline workers, getting them PPE and all of that, what is the situation as far as PPE is concerned? There was a time when there was a feeling that it was falling short. We didn't have enough for everybody. Is the position much better now?
The position is much better. At the very outset, at my place, it was never a problem, but it must have been a problem at so many other hospitals. But now on the PPE front, I think we are very comfortable and we have the right level of PPE at the right areas, and that's what is more important. The right level of PPE at the right area.
Doctor, if you look at just the last 24 hours and the massive jump in cases in India itself, the whopping rise in numbers, where are we right now? Yes, we are testing more, therefore there is a greater assessment of the numbers, but where do we stand in terms of fighting the pandemic across the country?
See, I think you said what is correct. If you test more, you will be more positive people. But if you see in totality, I can assure you, whatever the numbers you got from all over the world regarding the number of people needing hospitalization, number of people who will have minor disease, or number of people who will have just moderate disease, they are the same all over the world. And as a matter of fact, on a health front, I think we are doing much better than many other countries.
So, the work of Doctors Without Borders on the ground. Okay, joining us on the show tonight, we have with us Vikram Kirloskar, former president of CII and chairman managing director, Kirloskar Systems. Thank you so much, Mr. Kirloskar, for joining us. Now, before we talk about the work of frontline healthcare workers, I do want to understand from you, Mr. Kirloskar, how challenging have you found to reopen and get your businesses going with the fear of the COVID still surging?
Oh, it's a big challenge, especially on the dealer side, how to sell vehicles. It's been a terrible challenge, how to get a person into the dealership. We are doing a lot more sales on the net, but it is certainly a challenge. We are now working at about one shift level, roughly 50% of our production levels. The scare is there. I'm personally, scared. I'm carrying my mask all the time. I'm washing my hands all the time. We're being very careful. I wish the people in the factory also, they are the brave guys coming up there to work. Just like your nurses and your doctors, they are the really brave guys. We are the guys in the background that way. So I really feel out for them. It's a tough way to go ahead.
Mr. Kirloskar, we've seen some very frightening things happening in the United States, where several states, for example, are saying they may need to go back into lockdown because the numbers over there, 45,000 odd cases in 24 hours being reported. Here in India, we are seeing a huge surge of cases, for example, in the national capital. How disastrous will it be for us economically if we get into a situation when some cities actually start locking down again, if that is to happen?
Let me tell you very simply, in the auto industry, most of the break-evens are beyond 85-90%, of last year's sales, roughly. I'd say it's in that range for most companies. we'd be lucky if we do between 50 and 60% this year, with the way things are going. So you can imagine what the situation on the bottom line would be, what the situation on tax collection for the government would be. But this is for large companies. Imagine the plight of the small industry or the small shopkeeper, the restaurant owner, all those guys. It's going to be extremely tough for them without business going on. That's the fact. So I believe, like this whole mask and thing situation, when I go out, I don't go out much, but whatever little bit I have gone out, I still see people, wearing a mask like this.
Yep.
It has no meaning. I think we have to have respect for the people around us and make sure we wear a mask properly and wash hands and stay away.
Yeah.
Stay 6 feet away. That is key. There is nothing else that will help us combat this virus.
Yep. No, absolutely, sir. And to see people
basic
being,
stuff,
careless in our cities.
Discipline and respect.
Travel anywhere in the markets in Delhi, for example, people are not cautious enough because things are opening up. It causes so many problems. Exactly, sir. That's a problem. But Mr. Kirloskar, thanks so much for being with us and sharing those thoughts. Let's hope things get better for the sake of the economy and, of course, our health. Well, we have a very special guest joining us now, Suresh Raina, the former India cricketer. He's played 18 tests, more than 200 one-day internationals. It's great to have you, Suresh, with us. When you fought for India as a cricketer, you fought for your country, you gave it your all. And that's exactly what healthcare workers are doing now in fighting the COVID virus in India. What do you believe needs to be done to ensure that our COVID warriors are looked after?
I think they're going through a very tough time these days. We all need to be with them, and I'm so happy they've been looking after each and every patient in this COVID-19 situation. And I'm so thankful to all the doctors, and especially like Srinawas has been mentioning about how they have been looking after us and how they have been doing so hard work for us.
मैं सुरेश आपसे जानना चाहूँगी कि इन जो केयर गिवर्स हैं, डॉक्टर्स हैं, इनकी किस तरह से मदद की जा सकती है, क्या इनके लिए हमें करना चाहिए?
नहीं, मैं चाहता हूँ कि बस हम लोग उनको इंकरेज करें. वो हमारे लिए तो बैटल कर रहे हैं और अपनी फैमिली के लिए भी दे बिन बैटलिंग सो मैनी इन टफ वेज. सो मेरी यही सब लोगों से प्रार्थना है कि उनको आप सपोर्ट करें, उनको इस डिफ़िकल्ट टाइम में उनको रिस्पेक्ट करें और सबसे मोस्ट इम्पॉर्टेंटली उनको बढ़ावा दें, क्योंकि जिस सिचुएशन में आप देखेंगे पूरे वर्ल्ड में जिस तरह से डॉक्टर्स ने इस सिचुएशन को हैंडल किया, आई थिंक इट्स वेरी कमेंडेबल जॉब.
और हमने ये भी देखा सुरेश कि किस तरह से जो हमारे डॉक्टर्स हैं, हेल्थ केयर वर्कर्स हैं, पहले जब वो जा रहे थे उन पर अटैक्स हो रहे थे, पुलिस वालों पर भी हुए. उस लिहाज से क्या आप अपने फैंस को कहना चाहेंगे कि इससे बचें?
Remember, they are the cover which is protecting you, maybe not directly, but someone you perhaps might know. So I just want to tell you guys, you really need to be wise in this situation because they are doing so much for us, and don't disrespect them because you never know, you might see their faces on your door. So you just need to be calm and just be sure you look after their mind, you look after their safety. And if they are not helping us, you can imagine our life would be very bad. So please, I have a request, please support them and look after their mentally situation right now.
Suresh, thank you very much for sharing those thoughts and talking about the well-being of our COVID workers, the frontline workers. Well, some good news. Firoz Ansari is supporting this cause with 500 face shields worth 1 lakh rupees. 500 face shields. Each face shield can protect a frontline health worker. So very important.
हमारे साथ अब यश जयपुरिया हैं, CEO गिनी फिलामेंट्स के मैन्युफैक्चरर ऑफ PPE किट्स. यश, थैंक यू सो मच फॉर जॉइनिंग, टेकिंग आउट टाइम. व्हाट आर योर थॉट्स राइट नाउ? आई बिलीव यू आर सपोर्टिंग अ कॉज.
Yes, definitely. So I believe this is a very noble cause which everyone should actually support and pitch in. Well, I actually applaud MSF on the great work that they are doing across borders. The brave healthcare providers who fight COVID selflessly are admirable.
That's fantastic. And what really brought you about to sort of helping out in the manner that you are? Was it because you see citizens suffer all around you? How did you get into this?
We have been in the non-woven space for the past 15 years, and we've been making gown material as well as drapes material for a while. So now, actually, the time is right when our product is coming to use to fight COVID. So whatever the company can do, we are happy to do that.
यश, अगर मैं आपसे जानना चाहूँ, जो ये पीपी किट्स आप लोग बनाते हैं, हमारे जब डॉक्टर्स, हेल्थ केयर वर्कर्स इनको पहनते हैं, कई घंटे इनको पहनते हैं, इसमें मुश्किल होती है उनकी, उस लिहाज से क्या बदलाव हैं या क्या आप लोगों ने कुछ बदलाव किए या क्या सोच के बन रहे हैं इसमें, क्या है चीज़ें इसके अंदर?
I actually have like a complete presentation where I want to speak about like the standards which are prevalent in the country as well as internationally. So like one of them, like, is ASTM, and the other is an ISO standard. So ASTM classifies coveralls from level 1 to level 4 based on the increasing level of risk situations workers are in. So the frontline workers and the healthcare providers work in high risk situations and requires level 4 coverall protection. So in our factory, what we have done is that we have developed a particular type of non-woven, which is a laminated non-woven, which gives extremely good comfort to the user.
And that's so very important. Hopefully, changes in design will enable people to be more comfortable. This fight isn't ending. But thank you so much, Yash, for being a part of this and for your contributions. Thanks so much indeed. We're joined now by Sharika Amin, a Médecins Sans Frontières psychologist. Sharika, it's such a difficult time now for people around the world. How can people cope during the stressful period of the lockdown, as well as all of the fears connected to contracting coronavirus?
I feel the first step to cope with the situation is actually, to stop fighting the situation. Acceptance is key here, and I think what else works is to actually connect and share support for your loved ones, family, friends, and it's a very effective strategy. To combat fear, if you asked, which is very common in everybody, including us, is to remember to do what we can manage. Our focus, should be more on prevention and what is in our control. And I think one very effective strategy for that is to actually having a schedule or a routine that, gives a sense of purpose to our day. And mostly what's most important is to remember to fear what's necessary and not everything that's, around us or in us.
Sharika, what support is MSF providing in India and elsewhere in South Asia?
I think I'm really proud to say that MSF and the entire organization is dedicated for the cause and to help people and make their lives better. In the project that I'm currently working in, that is in Kashmir, we started a helpline since the lockdown period started for people who were suffering through emotional distress or any mental health issue that they could freely discuss through our toll-free number and could avail these services for free of cost. I think that was a initiative that did make a difference to the community and continues to do so. What's also noteworthy and praiseworthy is to mention that MSF India has come up with an even bigger initiative and has launched a pan-India helpline which is available 24/7 and is free of cost for anybody going through any mental distress or any emotional issue in need for support. And I think that's a very encouraging step in the field of mental health.
All right. Well, thank you so much for being with us and sharing that important perspective on mental health. We just don't talk about that enough. Devi Sridhar, Professor of Global Public Health at the University of Edinburgh and Founding Director of the Global Health Governance Programme, joins us now. Thanks very much, ma'am, for being with us. We're now in June, almost 5 months into the spread of the virus. What are some of the things we are learning about the virus and how it's behaving, which would be relevant to frontline health workers who do the kind of work that, say, Médecins Sans Frontières and others are doing?
Well, I think the first thing is the virus can present in so many ways. It can present like the classic symptoms, which are fever and dry cough. But increasingly, it can also present by a loss of taste or of smell, as well as others coming into hospital with, for example, blood clots in the lungs or having a heart attack or heart issues. It's a multi-system disease, which means it can affect the lungs, the heart, the kidneys, blood flow. And so it's recognizing that actually the wide range of presentation when you come in and also when you treat patients, the wide range of symptoms you'll need to treat.
And doctor, where would you characterize where exactly we stand as far as tackling the virus is concerned from a medical standpoint?
Well, it depends. The whole world, we're still on the upward trend of this pandemic. Every day, daily new records are being set for increasing cases. So first it was 100,000 daily new cases a few weeks back, and then it was 150,000, and now it's around 180, 190, and I wouldn't be surprised if we're at 200,000 within days. So it's really picking up pace and taking off. So we're just at, the start to the middle of this pandemic, unfortunately.
What would you say about the work of groups like Doctors Without Borders in fighting global pandemics like this, working across geographical boundaries? Because they obviously come under a lot of risk themselves.
Oh, they're incredibly important. I mean, groups like Doctors Without Borders is what will save many, many lives during this pandemic, because there are people who will survive this disease if they get appropriate medical care, if they get supportive care, whether it's access to oxygen, whether it's some, essential medications that are available in different contexts, or whether it's just supportive care. And so I think this is a virus and it's a disease that if you do need medical care and you do not get it, you will die from this. And so the group, these groups that are providing this medical care are saving lives and doing, very valuable work that we should all really applaud and support.
थैंक यू सो मच देवी श्रीधर. और अब हमारे साथ रिंस जोसेफ हैं, दिल्ली प्रेसिडेंट यूनाइटेड नर्सेज एसोसिएशन की. मैं आपसे पूछना चाहूँगी मिस जोसेफ, जो हमारे नर्सेज हैं, मेल फीमेल, ये फ्रंट लाइन वॉरियर्स हैं इस समय, बहुत मुश्किल भरा काम आप लोग कर रहे हैं. क्या सिचुएशन आपके लिए इस समय क्या ज़रूरत है? व्हाट आर योर नीड्स, मोस्ट इम्पॉर्टेंट नीड दिस टाइम राइट नाउ?
Actually, our need is, we approached the Supreme Court also, because the quarantine facilities must be given to the healthcare providers, because as 90% of healthcare providers, the nurses are females, and once they come to the hospital, they are becoming the carriers, and when they go back to their homes, they are putting their family at risk. So that is why we approached the Supreme Court also. The quarantine facility must be provided to the all healthcare providers, especially for the nurses. And the challenges is the nurses are wearing the PPE kit and 12 hours. 12 hours wearing a PPE kit is and the hectic duty, and there is no AC, there is no air circulation. That is another challenge. And the PPE kit what we are getting in the many hospitals, they're complaining the substandard items of PPE kit we are getting. And many of the hospitals, they're giving mandatory off for 15 days, and they're giving only 15 days salary. And how they can live in this metropolitan city. So these are all the main challenges, and the main issue is our quarantine facilities, because healthcare providers are every day the numbers are increasing.
All right, sir, thanks very much for telling us about this and the need to ensure that nurses are protected in this hour. Without nurses, all healthcare would fail entirely in our hospitals. Well, we've got a wonderful guest with us, Vidya Balan. Thanks, Vidya, very much for being with us. More than ever before, apart from precautions to take care of ourselves, we need to ensure that we take care of frontline healthcare workers. What do you believe needs to be done to ensure that they're looked after?
One, I think PPE kits must be provided to every healthcare professional that's out there, on the front lines, protecting us, doing their jobs in these difficult times. So I think PPE kits are very essential for their safety and well-being. And also I feel that they must be paid their wages, because I read some news that said in a lot of hospitals, or a lot of medical facilities, not just doctors, but the general healthcare staff is not being paid on time. And the least we can do at this time is to be paying them, diligently. Because they're really putting their lives at risk. They're doing their jobs. We are having to stay home for our safety. And it must be, we must make sure that they get paid on time.
बिल्कुल सही समय पे इनको उनकी तनख्वाह मिलनी चाहिए। विद्या, ये हमारे योद्धा हैं, कोरोना को मात देने में जुटे हुए हैं। हमारा भी दायित्व है कि काम करते हुए इनके पास सारे उपकरण हों, ये महफूज रहें। देश भर के लोगों से आप किस एक चीज़ की गुजारिश करेंगी इनके लिए?
यही कि पहले तो इनके साथ सम्मान के साथ आप बिहेव करें, इनको सम्मान दें, इनका शुक्रिया अदा करें, क्योंकि चाहे वो हम खुद हों या हमारे परिवार वाले हों, हम सब अगर सुरक्षित महसूस करते हैं तो ये इसी वजह से है कि ये हेल्थ केयर प्रोफेशनल्स अपनी जान जोखिम में डाल रहे हैं। और दूसरी बात, जहां तक हो सकता है जिस तरह से भी आप कंट्रीब्यूट कर पाए, जैसे उनके लिए पीपी किट्स जुटाने के लिए अगर आप बहुत लोगों ने ये फंड्स रेज करना शुरू किया है इसके लिए। मैं खुद एक कैंपेन का हिस्सा रह चुकी हूँ जो www.tring.co.in के साथ मैंने किया, और वी रेज फंड्स फॉर ऑलमोस्ट 20,000 पीपीई किट्स जो देश भर के मेडिकल प्रोफेशनल्स तक पहुंचाए गए। तो अगर आप ये कर सकते हैं तो बहुत अच्छी बात है, और अगर ना भी कर सकें तो एटलीस्ट इनके साथ अच्छी तरह आप बिहेव करें।
बिल्कुल आप सही कह रही हैं। अब इन स्वास्थ्य कर्मियों से भेदभाव होता रहा है, इन पर कभी हमला भी हो जाता है, तो इसे कैसे रोका जाए? लोगों को क्या ध्यान में रखना चाहिए?
हाँ, ये बड़े ताज्जुब की बात है कि लोग अपना गुस्सा इन पे निकाल रहे हैं, क्योंकि एक्चुअली ये हमें सेफ रख रहे हैं। और अगर आप अपना गुस्सा इन पे निकालेंगे तो एक वक्त ऐसा आएगा जब ये सारे प्रोफेशनल्स, हेल्थ केयर मेडिकल प्रोफेशनल्स कहें कि हमें घर से निकलने की जरूरत नहीं है, हम घर में बैठते हैं। वी आर पुटिंग आवरसेल्व्स एंड आवर फैमिलीज एट रिस्क एंड वी आर डूइंग आवर जॉब्स। और इसके अलावा अगर आप ऐसे बिहेव करते हैं तो फिर हम निकलेंगे ही नहीं, है ना? तो अगर आप सेल्फिशली भी देख लें तो आपको हेल्थ केयर प्रोफेशनल्स के साथ डिस्क्रिमिनेट बिल्कुल नहीं करना चाहिए। दैट इज मियर फूलिशनेस। इसका कोई रीजन नहीं हो सकता, कोई एक्सप्लेनेशन नहीं हो सकता। जितना आप में गुस्सा हो, जितना फ्रस्ट्रेशन हो, सब में है। पर हेल्थ केयर प्रोफेशनल्स में इस वक्त पे अपना गुस्सा निकालना, I don't understand it.
Vidya, the film industry and citizen groups in general have come together to try and help out such groups as well as others. How do we make sure that we take more steps to help out groups like Médecins Sans Frontières?
People across the board have been doing their bit. कितने ऐसे केसेस हैं जहां मैंने सुना है कि जो यूथ है एक सोसाइटी के, वो इकट्ठा होकर जो बुजुर्ग हैं सोसाइटी के, उनके लिए ग्रोसरी शॉपिंग कर रहे हैं, मेडिसिन ला के दे रहे हैं, या लोग हाईवेज पे माइग्रेंट लेबरर्स को खाना खिला रहे हैं, लोग बसेस का इंतजाम कर रहे हैं ताकि माइग्रेंट लेबर्स घर जाएं। तो आई थिंक अदर पीपल आर कंट्रीब्यूटिंग मनी। इट्स जस्ट वंडरफुल कि इस माहौल में आई थिंक वी हैव रियली सीन कि हम सब दीदार हैं, बस मौके की जरूरत थी. And I think that has to be really appreciated. बूंद बूंद से बनता है सागर. तो जितना आपसे हो सकता है, and most importantly, at least the people around you, if you start taking care of them. जैसे अपना staff हो गया, अपने कंपनीज में, अपने घरों में, उनका अपने ख्याल रखिए. उससे ज्यादा कर पा रहे हैं तो बहुत अच्छी बात है. पर at least charity begins at home. You must take care of the people in your immediate surroundings.
We've got a couple of wonderful guests, Rotary International joining us now, Dr. Bharat Pandya, Dr. Bal Inamdar, Kamal Sangvi and Shekhar Mehta. Dr. Pandya, let me come to you. First, you're a COVID patient yourself. Give us your understanding of the importance of caregivers at a time like this.
It's very, very important to realize two things. The first is that medical science is a science, and the outcomes of any treatment are not always predictable, and they may differ from patient to patient depending on the other comorbidities that patient may have. And the second thing is that we have to not look at COVID infections as a stigma. ये stigma की तरह जो हम COVID के patients को देखते हैं, we have to take them out of our mind actually. And if we keep these two things in mind and treat our healthcare workers, all the COVID warriors with great regard and respect, I think that this is the best thing we can do in this challenging and crisis time.
बिल्कुल. डॉक्टर बाल इनामदार भी हमारे साथ मौजूद हैं. साहब खुद एक डॉक्टर हैं. एक डॉक्टर की जिंदगी में क्या बदलाव आपने देखा जब से ये कोविड आया है?
COVID has created a new team of untouchables, especially the private practitioners. See, क्या हो रहा है कि डॉक्टर के पास अब लोग आने में घबरा रहे हैं, क्योंकि उन्हें लगता है कि डॉक्टर के पास जाएंगे, हॉस्पिटल में जाएंगे तो मुझे कोविड हो जाएगा. तो उनको जो खुद का जो प्रॉब्लम है वो सॉल्व करने के लिए भी आने के लिए कतराते हैं. सो दिस इज समथिंग विच इज़ नॉट गुड. एज डॉक्टर भरत सेड, इट्स वेरी इंपॉर्टेंट कि हम डॉक्टर्स को इस नज़रिया से न देखें. वी शुड गो टू डॉक्टर्स. और क्योंकि सभी हॉस्पिटल्स कोविड फैसिलिटीज़ नहीं है, नॉन कोविड फैसिलिटीज़ है, उधर हमने जाके अपनी ट्रीटमेंट करनी है. नहीं तो नॉर्मल डिजीजेस विल नॉट बी टैकल्ड, एंड विच इज़ नॉट गुड.
Right. Kamal Sangvi joins us as well. Mr. Sangvi, why is this cause so important for you?
This is extremely important, and I think it should be important to every citizen in India, because we all have to play our part. And especially the service organizations, NGO need to help every other organization. And I feel together on one platform, everyone has its own expertise. And we need to share our expertise. So in this case, the Doctors Without Borders, I think we need to help them. And especially in Bihar, what we are seeing is there is a surge of cases because the migrant workers are getting back and they need more facilities. And they are setting up these wonderful facilities with the government, 100-bedded facilities to treat, patients who are mild and moderate cases, so that so the other hospital facilities can look after people who are more critical. And I think Rotary wants to extend its hands to the Doctors Without Borders and setting up these hospitals with providing all the equipment which they need, maybe the oxygen concentrators, maybe the PPE kits and the ventilators, and any other facilities which they require. And I always believe that it's the responsibility of every citizen to come on board in this in any manner which they can, so that we can get rid of this pandemic as soon as possible.
बिल्कुल. शेखर मेहता हमारे साथ मौजूद हैं. शेखर जी, जो ये पूरा कॉज है आज का, ये तमाम डॉक्टर्स विदाउट बॉर्डर्स, किस तरह ठोस तरीके से इनकी मदद की जा सकती है?
रोटरी हैज बीन, मतलब हम रोटरी इंडिया में और पूरे विश्व में ही लगी हुई है कोविड पेशेंट्स को हेल्प करने के लिए. वो वेदर वी हैव हैड टू गिव मास्क और पीपीई किट्स, वी हैव गिवन मोर देन 1 crore मास्क टिल नाउ. 1 लाख से ज्यादा पीपीई किट्स हमने दे दिए हैं अभी तक. To Médecins Sans Frontières, we are happy to provide oxygen concentrators that they may need. If they need somewhere ventilators are required, we'll be happy to provide them, PPE kits, masks. इसके अलावा भी अगर कुछ जरूरत है उनको, whether it's in Mumbai or in Patna, wherever they may require, or across the country wherever they require, we'll only be too happy. You've just heard my friend Sandeep Agarwal had come in the beginning. He is from Mumbai. Their club itself is ready to provide things worth about 20 lakhs. Then the Mumbai district, it is called, it has a number 3141, and the next nearby one is 3142. The two incoming governors for them are Sunil Mehra and Sandeep Kadam. Both are committed, along with 3250, जहाँ से मिस्टर कमल सांघवी और राजन गंडोत्रा हैं. इन तीनों ने मिलकर कहा है कि ये 50 से 60 लाख रुपए की और वैल्यू के जो भी सामान चाहिएंगे वो देंगे. So the total exposure to our wonderful organization, for which Rotary has huge respect, we would be happy to provide up to 70 lakhs of rupees worth of equipment, and we will match it with them. And that's always
fantastic.
been our policy.
So 70 lakhs of equipment which you'd be willing to match. Thank you so much, sir, very much for that contribution and for being a part of this incredible cause. Thank you very much indeed, sir.
I think they're doing a great job, and we'll only feel very happy. Another thing I would like to say is that ये जो Doctors Day है, which is on 1st of July, I would say हम सबको उस दिन डॉक्टर्स को जरूर एक मैसेज भेजें. फिजिकली मिलना पॉसिबल नहीं है, लेकिन हम एक मैसेज जरूर भेज सकते हैं, उनको एनकरेज कर सकते हैं, हेल्थ वर्कर्स को कर सकते हैं.
No, and absolutely, and we really must do that. I cannot think that there's anything more important than to let our doctors know what we believe they are doing and how important it is. Joining us now, a fine doctor himself, Dr. Arvind Kumar, chairperson of the Center for Chest Surgery and Oncosurgery, director of the Institute of Robotic Surgery at Sir Gangaram here in Delhi. Thanks very much for being with us, sir. We've been talking now for a long time, several months. What are your thoughts presently from the day you heard the news until you've been fighting Corona today as a doctor, as a Corona warrior? You've been very worried, I know this personally, over a period of time. But how have your own thoughts on this illness evolved over a period of time?
So my first thought is that I wish it had not happened, because it has brought the world almost to a grinding halt. It has caused so much of misery to people and to the whole world. So my first thought is that I wish it had not happened. I know for sure that it's not the last time that such a pandemic has hit this world. And now with this climate change and air pollution issue being so glaring, so important, so relevant today, I know that we are going to be hit by more and more such pandemics in times to come. So the second thought that comes to my mind instantly is that instead of reacting in an emergency way, the way we did to this pandemic, we need to make our systems ready for such pandemics, resilient to face the onslaught of such pandemics, and so I would say able to absorb the shock that life can go on normally despite this. Side by side, another important thought that comes to my mind is that we need to do something to stop the animal-human interaction, which is the cause of this. If you look back at last 20 years, whether it was SARS, whether it was SARS, whether it was MERS, whether it was Ebola, Zika, and now Corona, these are all animal viruses which have skipped species and come from animals to humans. Why has it happened? Because of increased human-animal interaction. And with now climate change being what it is, we are going to see more and more of it. And as a doctor, my biggest fear is, are we going to see more and more of such pandemics in times to come? So that's a frightening thought that I have in my mind.
जी डॉक्टर अरविंद, जो अभी कोविड-19 है जिससे हम मुकाबला सब कर रहे हैं, 3 या 4 महीने या 7-8 महीने रहेगा हमारे सामने, क्या आपका आंकलन है? और जो हमारी मेडिकल फर्टर्निटी है, हमारे जो केयर गिवर्स हैं, उनको हम कैसे और मजबूत कर सकते हैं?
देखिए, सबसे पहली चीज जो हम उनके लिए कर सकते हैं वो ये है कि जो नंबर्स के प्रेडिक्शंस हैं हमारे अगले 2 महीने के बारे में, जैसे हम दिल्ली की बात करें तो हमारे स्वास्थ्य मंत्री ने कहा था कि 5.5 लाख केसेस और 80,000 बेड्स की रिक्वायरमेंट होगी। देश के बारे में भी बहुत तरह तरह के मैथमेटिकल मॉडल्स आए हैं। तो मेरी पहली थॉट एज ए डॉक्टर ये है कि हम लोग आज क्या सब लोग मिल करके वो कदम 100% नहीं उठा सकते जिससे ये सारे मैथमेटिकल मॉडल्स फेल हो जाएं और हम वो नंबर हिट ही ना करें। फॉर एग्जांपल, अगर जुलाई के अंत तक दिल्ली में 80,000 बेड्स रिक्वायरमेंट हुई तो किसी भी तरह से वो पूरी नहीं। तो मेरा पहला जो एक थॉट के ज्यादा मैं कहूंगा, एक मेरा भगवान से प्रार्थना है वो ये है कि कुछ ऐसा कर दो जिससे लोगों में समझ आ जाए, लोग बाहर निकलना कम कर दें, आपस में प्रिकॉशंस लें, जिससे ये संक्रमण की जो रेट है ये कम हो जाए, मैथमेटिकल मॉडल गलत प्रूव हो जाए और हम वो नंबर हिट ना करें। ये मेरी पहली थॉट है एज ए हेल्थ केयर वर्कर। उसके बाद नेक्स्ट थॉट है कि हम लोग कम से कम बीमार पड़ें और ज्यादा से ज्यादा लोगों की सेवा कर पाएं। क्या होता है कि अगर एक हेल्थ केयर वर्कर बीमार पड़ता है तो जो हेल्थ केयर का पूल है उसमें एक की कमी हो जाती है और जो पेशेंट की संख्या है उसमें एक की वृद्धि हो जाती है, क्योंकि वो केयर प्रोवाइडर की जगह केयर सीकर बन जाता है। और जितने ज्यादा हेल्थ केयर वर्कर्स बीमार होंगे उतने ही ज्यादा वो प्रोवाइडर से सीकर में कन्वर्ट हो जाएंगे। तो आपके प्रोवाइडर्स का नंबर कम हो रहा है और सीकर्स का नंबर बढ़ रहा है। उसी तरह से ड्यूटी करने के बाद जब लोग क्वारंटाइन में रहते हैं तो उससे भी नंबर्स कम हो जाता है। तो जैसे जैसे हमारे पेशेंट्स की संख्या बढ़ रही है, हमें ज्यादा से ज्यादा हेल्थ केयर वर्कर्स की जरूरत है। तो सबसे पहली जरूरत है कि हमारे कम से कम हेल्थ केयर वर्कर्स बीमार हो और एक भी हेल्थ केयर वर्कर की डेथ ना हो, किसी के साथ ये दुर्घटना ना हो, लोग बीमार कम से कम हो, जिससे ज्यादा से ज्यादा संख्या में हम सब हेल्थ केयर वर्कर्स मिल करके अपने देशवासियों की सेवा करके देश को जल्दी से जल्दी इस महामारी से बाहर निकल पाए। ये मेरी थॉट है एज ए हेल्थ केयर वर्कर।
Right, Dr. Kumar, thanks very much indeed for that. Let's now go across to Melissa Mcrae, Medical Director, MSF. Melissa, can you tell us how does, because you work all around the world, how do you choose where to operate in the world?
Yeah, so Médecins Sans Frontières is really driven by the humanitarian needs and particularly responding to the health needs around the globe where we see they are greatest. One of the key points for us is that we can remain to be independent action, mostly due to the very generous donations of our donors. But being able to select where we see the needs are greatest is a really key part of selecting it. We particularly look at where there is persecution, injustice of any form, particularly needs around the most vulnerable populations, women, children under 5, particularly war zones and conflict zones. Obviously, with the COVID-19 epidemic, all of our settings have been affected.
Okay, so tell us about some of these difficult decisions that you've had to make.
So, of course, the global humanitarian health needs absolutely outweigh our resourcing, but any one organisation's resourcing. We often have to make really difficult choices of where we will intervene, to which population group we will intervene, and also to what level of health servicing we actually end up providing compared to community hospitals. It's very difficult to make those decisions and to really make sure you are responding where those needs are greatest, which is what drives us.
Right. And Melissa, I asked this question earlier in the show as well. How has this pandemic been different from other pandemics you fought, like Ebola, for instance?
Yes, good question. As an emergency medical organisation, obviously we respond to a lot of outbreaks and pandemics. The difference here is actually the global nature of it as such. The scale of this is far larger for us. One of the other differences as well is just the impact it's had on travel restrictions and supplies, and just the supply chain that is affecting all of the countries around the globe. Some of this was seen in the West Africa Ebola epidemic that you mentioned, we had a very large response there as Médecins Sans Frontières, but it was still contained to those couple of countries where the majority of transmission was happening. That's very different in the COVID response. I guess some other challenges in COVID particularly is just the availability of testing. We don't have reliable and easily accessible testing to diagnose the people who are affected with COVID. And of course, the treatment is not available. We are still working where we can to trial medicines to see what is working to provide the best care we can. But we are learning every day, as is many other healthcare providers, of just how to best respond to COVID.
All right, Melissa Mcrae, thank you very much for joining us over there. We have an absolutely incredible guest who joins us now, Vishwanathan Anand, 5-time world chess champion, Rajiv Gandhi Khel Ratna awardee. Vishy Anand, thanks for being a part of this. How has life changed for you in these crazy COVID times? How are you dealing with this new normal?
It's now not 4 months, but really about 3.5 months that I have not interacted with that many human beings. That is strange. Chess players, we often sit alone and we often isolate ourselves and work, but this is crazy. I've never had anything like this. I come back home and we haven't left home in 3 weeks. My first week was home quarantine. So I actually had, Aruna gave me the bedroom, locked everything up and said, I'll push the plate under the door and that's it. But even subsequently, because the lockdown restarted on the 19th, and so that's another week that I've just been sitting without being able to meet anyone, nothing. And everyone's walking in the streets with masks. The streets are just empty. It looks like one of these slightly frightening movies that we used to watch that took some scenario to some absurd level, and here we are living it.
So do you miss that, Vishy Anand? Do you miss the normal course of human interaction?
Yes, I did. Even when I was training intensively, we would still every few days go to Frankfurt or go somewhere and meet a lot of people and things like that. Another thing which was very strange was you hardly saw anyone in the streets there. Everybody kept a huge distance from each other. People made a conscious effort to avoid each other. All the places, in the moment of good weather, everybody comes out and starts to have something to eat in cafes and so on, empty. So life wasn't disrupted, but you could see that something was wrong. And of course, I've started to miss human contact and the ability to do just all sorts of normal things and so on. The flip side is the last 3 weeks I've actually been home next to my wife and son, and that's compensated for a lot. But there used to be a world outside to step into, and now there isn't.
All right, Vishwanathan Anand, let's hope that this madness all around us, staying indoors, ends for good once we are safe from a medical standpoint. But unfortunately, it seems it's going to be some time yet. Joining us now, Lina Minghani, she's with MSF Access, Médecins Sans Frontières. Thank you very much for being with us as we are your partners in this mission. How close are we to seeing a vaccine in this fight against COVID-19?
Yeah, I think this is on everyone's top of their mind that, the vaccine is going to be coming along and, we're going to get ourselves out of this economic and social isolation with the vaccine. But I would like to also emphasize that as MSF, we give equal importance to therapeutics, the medicines that are needed today, as much as to the vaccine. So I think we have to learn to live with COVID firstly. You have over 100 candidates. You have the best scientific minds on it. But what is really disturbing is that we still don't have a framework to decide about whether the poorest and the most vulnerable in the world will be ensured access to the vaccine. So if there is a breakthrough, India will be making those vaccines, because without India, you cannot move along. But what is not in place is a very good framework that the poorest and the most vulnerable should be getting the vaccine.
Lina ji, what is being done to make sure that everyone is able to access a vaccine when it is created?
Well, there are a number of initiatives. The WHO is working on an allocation framework. You've got the Vaccine Alliance working on pledging money and raising money for the vaccines. You've got CEPI, which is the Coalition for Pandemic Emergencies. You've got lots of good minds and a lot of good institutions working together to do something about creating access to vaccines. But actually what has really happened is, and this happened in 2009 as well, is that the wealthiest countries are already drawing deals with big pharmaceutical companies to ensure access to people in their countries. And that in some ways undermines the solidarity that we need at this point, is that whether you're rich or poor, wealthy or not, you should all be ensured access to vaccines. So I think in the coming year, I think the Vaccine Alliance, CEPI, WHO will all be tested in their ability to ensure access to the most vulnerable.
Okay, Leena Mengani, thank you very much indeed for joining us. So we have come to the end of our special broadcast, but you can still contribute to the incredible work that MSF and its frontline workers are doing. The details are up on the screen, but you can also go to our website ndtv.com and you will find plenty of information about how you can contribute.
And what better way to end this show than a unique anthem with a powerful messaging of love, hope and happiness. Dedicated to frontline warriors and all of humanity, the essence of this song is captured in the universal language of Sanskrit. Lokaha samataha sukhino bhavantu, samastaha lokaha sukhino bhavantu. Which means, may the whole world live in happiness. May all the worlds live in happiness. Conceived and produced by Phase 1 Experiences. Music composed by Raghu Dikshit. This message is from us to all of humanity.
जाओ ना हर दर पे मेरे दिल की दुआ, झूम के अंबर से घर घर पे बरसा, धीमे से कुदरत को मरहम तू लगा, हर जग की किस्मत फिर जगा। एक ख्वाब तो हर आँख में, हर आँख का सच बने, हर होठ पे एक साथ में मुस्कान आके खिले, सुख बरसे नहीं तरसे कोई जीव जल